Several aspects to screening. One is the PSA, which is the prostate-specific antigen level.
Yes.
Okay, let's go over that.
Right, so PSA is a protein which is found in the blood and in with the prostate. So PSA is basically only made by prostate cells, and prostate cancer cells also make PSA. The problem with PSA is that it can be made by both healthy and cancerous cells. Mm-hmm. So just because your PSA is elevated doesn't mean you have prostate cancer. It means we need to look into further why the PSA is elevated. But that's a very important distinction. And the PSA is measured by just drawing your blood. So it's a simple blood test that we can do.
All right, so I had my test last year, and my doctor was alarmed. My PSA was up. Mm-hmm. He said, come back, let's do it again in a week. When I did it in a week, it was fine. Personal stuff, but why would it be up on a particular day when there really is not an issue?
Right, so there can be some variability in the test depending on what lab it was drawn at, but presuming it's the same lab, your PSA can vary just with the amount of inflammation in your prostate. So if you have some prostatitis or swelling in the prostate, your PSA can go up very high, and it doesn't mean you have cancer. So there is some variability, which is why we never really base any results or any treatment on just one test, which was smart that your physician did that.
He did. All right, and then there's the Gleason score. Explain what that's about.
So once you have a diagnosis of prostate cancer, which we only make by looking under the microscope, so we need to get tissue and look at it under the microscope. When the pathologists look under the microscope at the glands in the prostate, they assign this thing called the Gleason score, or the Gleason grade. And basically, it's a standardized way we can look at the aggressiveness of each prostate cancer, because they're all very different. And your Gleason score becomes very important. Basically, the higher the score, the more aggressive the cancer. And for practical purposes, the lowest score is a 6, the highest is a 10. It's a little more complex than that, but those are the overall score ranges.
All right, let's talk about some of the aspects of some of the specifics of it. You talked about you might get a PSA that's I guess it's a false PSA. Are there other things you can get that can kind of conditions that can give you symptoms like prostate cancer but aren't?
Yes, absolutely. So if you have an enlarged prostate, which for men, as we age, our prostates all grow, and that's a natural part of aging for men. They all do to a different extent.
This is why I get up at 4 in the morning and go back to bed. Listen to Big Daddy Grand for a minute and go back to bed.
Exactly, and that's why as men our streams go from being able to write our name in the snow to sort of a drip, 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 right? So
depends how long. Yeah, your name's Thomas Sheffield. Right? It's tougher
takes
for
me all
you.
day.
Right.
Exactly. So when your PSA can go up from that, and you can have urinary symptoms from an enlarged prostate. That's not cancer. You can also have blood in your urine from other things, from bladder cancer, from an infection in the bladder, from kidney stones, bladder stones. So those things can cause symptoms that can, sort of overlap with prostate cancer, but doesn't necessarily mean you have prostate cancer.
Okay. We talked a little bit, but let's get specifically into diet and diet supplements. Let's start with diet. Is there anything that you should absolutely have in your diet, be conscious of it, or anything that you should try to avoid?
Right. So in general, anything that's bad for your heart, anything that's bad for your body in general is bad for cancer, and not just prostate, but many cancers. So foods high in fats, total fats, lots of red meat, okay, those things are all, in general, overconsumption of those, not good. You don't want to overchar or cook your food. That can also affect your risk of cancer, okay? So you want to stay with green vegetables, fruits, right? Lean proteins, vegetable-based proteins, and low-fat diets. All those things, a general heart-healthy diet is healthy also for your prostate.
Good for you in all ways.
Yeah, absolutely.
Okay. And dietary supplements, what should we think about with that?
Yeah, there's tons of stuff about supplements on the market and their effect on the prostate. So for the most part, most of the data on supplements is equivocal, meaning there's no direct link between taking a supplement and cancer risk. I would caution you, a lot of the research I did was in folic acid or folate. Mm-hmm. All our foods are fortified with folic acid, our grains, our breads, our cereals, and we are getting supraphysiologic levels of folate in our diet. And we know that there's some linkage with that in prostate cancer, which I've shown in some of my studies. So definitely overconsumption of folate-containing foods and folate multivitamins, not a good idea from a prostate cancer risk standpoint. So what does that mean? If you're a man in the age range where you're at risk for prostate cancer, I would find one that doesn't have folic acid in it, okay? This is not to be confused with,
I'm writing this down.
Okay.
I mean, I take a multivitamin,
Yeah.
I'm in that age, I never consider that.
yeah, I mean, I
All
would
right,
not.
folic acid, is it in my one a day?
Yes, exactly. So make sure, because some of them have it, some of them don't. And this is not to be confused with women who are on folate for entirely different issues, and it's very important. But that's something for our men to consider.
Folic acid, no. So
Yeah.
there we go, I wrote that down.